The population that this presentation will focus on is Spanish-speaking Hispanics and Latinos aged 45 and over. I am a 26-year-old white female who speaks English only, so this population differs greatly from myself. The health need for this population is diabetes teaching and tracking. Hispanic and Latino ethnicity and 45 years of age and older are two unmodifiable risk factors for type 2 diabetes, so this disease is prevalent in this population. Special learning considerations include a language barrier. Spanish-speaking patients do not have nearly as many educational options available to them as English-speaking patients, and their understanding of the disease and disease management is limited because of it. Technology has advanced so much in the last few years. Nearly 70% of adults over the age of 30 use a smartphone. On those smartphones is an immense wealth of knowledge available through the internet and available applications. According to healthcare providers and patients alike, research has shown that mobile phone applications or apps can assist greatly in patients' management of their chronic conditions. One trial in particular evaluated an app designed to help elderly Spanish patients reduce non-adherence and medication errors when taking multiple medications. The trial reported that app users had significantly better adherence to their medication regimen, fewer missed doses, and a significant reduction in medication errors. The tool I have chosen is a mobile app available in both English and Spanish languages that is an all-around diabetes management tool. The app would have basic information about the disease, including links to more expansive resources such as the American Diabetes Association website. It would also include a blood glucose tracker in which patients could input their blood glucose level when they check it so that it can be monitored over the long term, just like a regular blood sugar log. The app would also have a food journal feature so that patients could input their daily meals and snacks to keep a better eye on what they are putting into their bodies. This feature would additionally have nutrition information inputted. For example, a patient could log their breakfast as 1 cup of cooked oatmeal with a tablespoon of honey, a teaspoon of cinnamon, 1 medium-sized orange, and 12-ounce cup of coffee with 2 tablespoons of skim milk. The app would have nutrition information stored in it for foods, so the patient would see instantly that for breakfast he or she consumed X grams of carbohydrates, Y grams of protein, and Z grams of fat. This is so that in addition to keeping a basic log of their meals, patients can see exactly how many carbohydrates, proteins, and fats are in the food they are eating. This is helpful for those patients who have to administer insulin based on a carb ratio, for which the app can also have a calculator function. It also allows the patients to show their physicians and nutritionists exactly what they are eating so that diets can be adjusted if necessary for management of the disease. One feature of smartphone apps that can also be used in this situation is notifications. The app can send the patient reminders, like a text message, at specific times of the day, reminding them to check their blood sugar or to take their medication. This tool is appropriate for this population because, as stated earlier, the majority of patients own smartphones, and although there are many separate diet and glucose tracking apps available, there are no comprehensive diet, glucose, and medication management apps, and many diabetes-related apps do not accommodate the Spanish-speaking population. This use of technology is helpful because healthcare professionals continue to encourage food journals and blood glucose logs, and maybe not everyone in the world has a smartphone, but even fewer people carry around a pen and paper at all times to write down everything they put in their mouths. This health tool can contribute to critical thinking in many ways. The critical thinking skill of information seeking would be developed, as the app would have many links to organizations where further information is available, like the American Diabetes Association, as stated earlier. It could also help develop the skill of predicting. If a patient uses this app consistently for an extended period of time, they may begin to think critically about all of the foods they are eating and to predict how it may affect their blood glucose levels. Similarly, the app would help patients develop the critical thinking habit of reflection. After use of the app, if a patient sees improvement in their diabetes management, they may begin to reflect upon what they were doing incorrectly in the past that was holding them back from better managing their disease. This app could contribute to nursing practice in that it would be another tool available for nurses to utilize to better teach our patients about their disease and to overcome some of the barriers to diabetes management, like the language barrier and medication noncompliance. It would allow nurses to give advice to patients based on the information that they log into the app. Similarly, this app would contribute to patient outcomes because it would increase medication compliance through reminder notifications. It would allow for easier logging of blood glucose levels over pen and paper, and would be able to show a graph of the levels over time. And it would assist in patients becoming more conscious of their food habits and choices and aid in better dietary control. Technology in general has a large impact on nursing and patient outcomes. Technology assists nurses in learning more about diseases and illnesses so that they may better educate their patients, and in cases like personal mobile apps, it assists nurses in learning about one patient's specific health needs. Technology in the form of mobile apps, websites, and online education presentations assist nurses in continuing education so that they keep up to date with the most relevant evidence-based practice guidelines and keep refreshed on the skills or information which they do not use as often. This then translates to better patient outcomes because the nurses taking care of patients directly have easy access to any information that they may need to provide the best patient care. Technology also provides for better patient outcomes because patients have and can become more aware of and involved in their own health. There is an endless amount of knowledge available to people on the internet, and if they so choose, one can learn seemingly anything and everything there is to know about a condition, medication, procedure, and anything else in between. When a patient feels like they can handle the information given to them by a provider, such as when they have already researched a topic by their own, they feel less overwhelmed and are more inclined to continue to be involved in their own care.